Living in a post-pandemic world can be challenging, even more so for college students. In recent years, mental health issues for this large group of the population have skyrocketed. But we are here to let you know that it's okay to not be okay, and that effective, easily accessible help is available.
College of DuPage is really focused on student success. And anytime a student is struggling, and I think even with mental health issues, it gets in the way of student success.
School has always been stressful, for students. I don't think that's going to go away. I think that's just going to continue.
We, I think, don't appreciate the college transition as being one of the most challenging periods in one's life.
Obviously, there's a huge amount of stress that students are dealing with, and I think it's coming at them from all areas. I think it's personal lives, I think it's difficulties with relationships, I think it's difficulty with the transition from adolescence into adulthood.
I have students that just have difficulty coming to campus because they get so anxious being surrounded by other students. Some of them, they can't even leave their cars to walk to their classroom and be with other students because it's just so anxiety provoking.
And while you may not think that mental illnesses are common, data tells another story.
Very clearly, the numbers for mental health concerns have significantly gone up. Before COVID, the numbers were about 8% of US adults would say that they have felt depression.
Anxiety probably can be diagnosed, I think, in about 55% of the US population. Very, very high rates.
I would say about 75% of our students experience some type of mental health issue.
When adding these numbers to the already stressful lives of college students, it's easy to see they are facing some challenging times. A recent study of College of DuPage students about mental health revealed some surprising data.
Anxiety was the highest, with about 80% of students endorsing that they experienced anxious symptoms in the past 12 months. Things like depression were about 60%. Issues with family was more than 50% of our students who responded to the survey indicated that family was a source of distress.
Left untreated, depression and anxiety can lead to severe consequences, including death.
Depression is episodic, so the episodes will keep coming back more severe. Obviously, there is a functional impact, but in terms of suicidality, what is concerning is that it is now the number 2 cause of death in individuals between the age of 15 and 55.
And so we have to ask, what's going on? What is going on with young people that they're thinking about dying by suicide? I think there is a lot going on in their environments and society that are just, triggering.
So what are the causes of mental illness?
With mental illness, the causes are still quite vague. What we do know through things like twin studies or family studies, that there is a genetic component to many mental illnesses.
There is a neurochemical basis that we know has been demonstrated. And then there is the hormonal theory of depression, where you look at postpartum depression and those conditions. There is the stress diathesis model of depression, which is related to folks being under undue stress.
But we also know that there is a social component to it. So how is the environment affecting people? So is there trauma at an early age, for example? How our relationships in childhood affect us, neglect or living environment?
The symptoms of mental illness aren't always easy to recognize.
It's so much more common. I think anybody can say that there's a day sometimes that they just feel down. Sometimes they just don't feel like they're themselves. And the tipping point just becomes, though, is, well, how long does that go for? And how much is it impacting me in my day-to-day life? And there's where sometimes we start to look at, well, what is maybe a short-term, brief, normal reaction to what's happening in my life versus maybe something a little bit more serious that may warrant some professional attention.
Friends and family can be a great tool for seeing what's going on with somebody, for identifying if there is something that seems off. And what that thing that could be off is significant changes, again, that have lasted for a long period of time. That could be changes in the way the person's eating, in the way the person's sleeping. So sleeping a lot more, sleeping a lot less, eating a lot more, eating a lot less, isolating. All of those can be indications, and family and friends, I think, are a great tool for kind of reading that and sussing that out, because they'll see if something's off with the person, and if it's not just like a bad day, but it's, this has been going on for a significant period of time.
Before treatment can begin, a diagnosis must be made.
Diagnosing is something that takes a little bit of time. Our focus is looking at thoughts, feelings, behaviors. There is no such thing as a blood test you can take that if you go to a doctor, like for other illnesses, you can go in, you can, get tested for, do you have strep or not? What's causing that sore throat? With mental health, unfortunately, we're not there yet. We can't just go in and do blood work and say, this is what you have.
And getting a good assessment is important. So high-functioning individuals may not even identify it. Others in their family may identify and say, hey, it looks like you may be depressed. People that are high-functioning may all of a sudden experience an episode and not realize that part of what's contributing to their challenges is depression.
Looking at our diagnostic statistical manual, all of that is referenced in there. So clinicians kind of have this idea, all right, this person's presenting with depression, and we know their mother was diagnosed with depression, and a sibling was diagnosed, and so that might mean that they're more likely to also experience depression.
But what we can do is get a sense of, what have your thoughts been? What have your feelings been? What are your behaviors like? How long has it been going for? Are other people noticing these things? And that's what can kind of help us narrow in and understand what is it that's really happening as far as a diagnosis, which then can drive our treatment.
After a diagnosis is made, many effective treatments are available.
So if you do have a diagnosis and the professional says, it looks like you do have anxiety, or it looks like you do have depression, they can talk to you and collaborate on a number of treatment options.
There's multiple types of treatment for mental health. So starting with talk therapy, I think that's what most people think of when they feel like, okay, I've been depressed or anxious, I'm going to go talk with somebody.
Cognitive behavioral therapy is one of the gold standards of effective treatments. Changing your behaviors in order to change your thoughts, and vice versa.
The problem-focused cognitive behavior therapy can be very effective. So, this is not therapy where, you're talking about growing up or anything. It's very, very problem-focused. You understand the triggers, you understand your thinking and your reaction around the triggers, you understand, and you develop strategies to manage those.
We also have medications. So there are definitely some types of diagnoses that benefit from medications.
The medication options are plenty. Most of them are very safe. None of them have any long-term, serious effects. There are other approaches now that are looking at, for example, glutamate and the ketamine approaches to depression, which is really looking at a new approach to treating depression, which has had some wonderful results. We've also had something that I've researched myself, is transcranial magnetic stimulation, where you really apply a magnetic field over the surface of the brain to stimulate it. That has had some wonderful results.
It might include different things you can do for yourself in terms of physical exercise, changing your diet, some simple things that may benefit you, and in conjunction, there may be a menu of 2 or 3 different things that works best for that person.
As you can see, a variety of mental illnesses are common among college students. But the good news is, easy to access, proven, effective help is available. College of DuPage offers free counseling, available through counseling, advising, and transfer services. Located in the Student Services Center, SSC 3200, or by calling 630-942-2259.
Give us a call, let us know what's going on and what you need, and then we'll help you out. We'll figure out what you need to do. We'll connect you with a counselor who will have a conversation with you about what's going on with you. And from there, we're going to figure out how to best help.
Once you're in the door and get the appointment, I think that's the hard part is over. But it's kind of getting that courage to make the appointment and to call and get set up. But once you're in our office and you're meeting with us, students will often tell us that it wasn't as scary as they thought it would be, or they'll say, gosh, I waited like 3 months to call. I've been thinking about it for a long time, but now, I'm glad I finally did.
It's all about not being alone. It's all about, really knowing that the college is here, the college cares, and we want you to be successful. Everybody who comes here has a goal. We want them to be able to achieve that goal.
In the post-COVID-19 world, mental illness is more prevalent than ever. And that's particularly true for college students. But what causes mental illness, and what is the physiology behind it?
There's nothing more complicated in the universe than the human brain. And so it's understandable that it's not always going to be in perfect balance and perfect harmony.
So mental illness really is driven by, in the symptoms of mental illness, really come down to how certain chemicals act in the brain.
The brain tends to really be a chemical machine in a lot of ways, and the interplay between the chemicals is critical. We are continuing to learn about various aspects.
Unlike physical illness, mental illnesses have a variety of causes that often work in concert with one another.
The modern understanding of depression is that there is a neurochemical basis that we know has been demonstrated.
There's a lot of research on depression that will kind of talk about the neurotransmitters. And when we talk about medications that are often administered for depression, they are medications that directly interact with these neurotransmitters in our brain. So things like serotonin and dopamine, for example.
There is a genetic basis that has been studied through genes, and there are a couple of genes that been identified that demonstrate those individuals are more prone to depression. And then you have the hormonal theory of depression, where you look at postpartum depression and those conditions. So that has been well studied. People who have thyroid conditions, etc., are prone to depression. So it is very important to look at depression as a complex illness that has a genetic basis, that has a biochemical basis, that has a neuroanatomical, neurochemical basis, as well as a psychological and social basis.
Like depression, little is known about the physiology of anxiety. What doctors do know is many of the same systems and chemicals are involved.
For anxiety, there may be even a little bit more of these peripheral systems being involved.
There's a very physiological response that happens, and people feel it and often describe their anxious symptoms as happening in their body.
There is an impact of serotonin and norepinephrine, and we know that because of the evidence that around treatment.
Trauma and anxiety or any stress reaction has your nervous system up. Elevated into fight or flight. There's also freeze and fawn.
They might describe, my hands are sweating, my heart is beating out of my chest. They might feel in their stomach tightness. Their muscles might get tight. Their breathing might become more shallow. So it's all very physical symptoms.
While depression and anxiety are distinctly different diseases, they share several similarities.
Severe anxiety leads to depression. Severe intractable anxiety that you're not treating will lead to kind of a sense of hopelessness and helplessness and the anhedonic response.
There is also a link between mental and physical health.
There is a study in the early 2000s, the ACEs study, is Adverse Childhood Experiences. All of your physical symptoms of various medical diseases go up every time you have one of these ACEs. So they're directly correlated, your physical health and mental health. There's an increase in autoimmune disorders, diabetes, asthma, COPD, heart disease.
While mental illness is most often looked at as a psychological disease or as a reaction to environment, It is important to remember there is a complex physical element to these diseases.
At the end of the day, in our brain, we have a lot of neurons in our brain, and we have a lot of chemicals that go back and forth between the neurons, and our brain is always trying to make sure we have just the right ratio of a number of these chemicals in between these neurons. Mental health knows no boundaries when it comes to socioeconomic status, backgrounds, you name it. It is definitely equal opportunity as it comes to mental health issues.
While that is true, mental illness issues are affecting college students at a much higher rate, now more than ever before.
We, I think, don't appreciate the college transition as being one of the most challenging periods in one's life.
Obviously, there's a huge amount of stress that students are dealing with, and I think it's coming at them from all areas. You know, I think it's personal lives, I think it's difficulties with relationships, I think it's difficulty with the transition from adolescence into adulthood, you know, that identity stage of, you know, who am I, trying to figure out my role.
There's more and more college students that are working. Some of them are taking care of, you know, loved ones at home. Some of them are parents, and they're taking care of their kids.
College is a time of transition. College is a time of identity development. College is a time where we're trying to figure, ourselves out. But I think it's a little harder when you don't have the time for that. And there's a lot of distraction and things getting in the way of you connecting with yourself.
With the lingering trauma brought on by the COVID-19 pandemic, it's easy to see how the road to college success is beset with pitfalls to a number of mental diseases.
Coming back from the pandemic, we're seeing this really big shift in the way that people are just not comfortable interacting with one another.
And I think instructors were noticing that students were not only not engaged, but they were also more emotional. And as they were reaching out to students, trying to connect and kind of saying, hey, what's going on? Students were more, they were more willing to share, I'm having a hard time.
For students, we often think about academic symptoms, and when we talk to instructors, we want them to be aware of that because they're often the first people who might notice some of these symptoms in their students.
What we were noticing from the college behavioral intervention team was a lot of instructors were referring students that seemed like they weren't connecting in class. They weren't showing up for class. They were falling asleep during, Zoom calls, or they would come to class and then not come to class for several weeks and fall behind.
Once symptoms are recognized, it is important to get a diagnosis.
The things that we look for are the severity of their symptoms, the frequency, and the duration.
The big difference between just having a bad day or two and maybe having something that could be a diagnosis or could need additional help is if it's persistent.
I find that people come and seek help about a week to 2 weeks in because they're not functioning the way they used to. People are concerned about them, and they realize that they're not going to just snap out of it on their own, and they'll seek help.
What stops most people from seeking help is the stigma associated with mental illness.
Sometimes people view things in mental health as being a sign of weakness. I've been through something and it didn't bother me, why should this bother you? And that could not be more further from the truth.
For a lot of people, family, even though it can be a great source of support, can also sometimes be a big obstacle toward getting help. And if the message that they're getting from the family is that they just need to toughen up, or they just need to get over it, or they just need to stop doing that, that kind of mentality has held us back in many ways.
What you need to know is that it is vitally important to make the first step towards good mental health.
I really do think that the first step is always to say, you know what, I'm not feeling okay. Like something just doesn't seem quite right and I need help. And there's no shame in asking for help.
Once you're in the door and get the appointment, I think that's the hard part is over. But it's kind of getting that courage to make the appointment and to call and get set up. But once you're in our office and you're meeting with us, students will often tell us that it wasn't as scary as they thought it would be, or they'll say, gosh, I waited like 3 months to call. I've been thinking about it for a long time, but now, I'm glad I finally did.
I would want to tell you, if you were willing to come to me and express some kind of struggle you've dealt with, I would first want to just acknowledge that. Acknowledge the fact that it took a lot of courage even to be willing to speak up.
If a student at COD is looking for help, they can really go to anyone at COD. The campus is a caring community, and so we at COD train faculty and staff in terms of where to bring a student who is kind of stating that they need some help.
Just understand you're not alone at all. In fact, you're probably in the majority of people who are not feeling well, and that's normal, and it can also be helpful possibly to seek out some help if you really need it, because that too is normal.
While there is no known cure for mental illness, there are a number of varying and proven effective treatments available. After a diagnosis is made, patients work with their therapist or other healthcare professionals to determine options for the best course of treatment.
If you do have a diagnosis and the professional says, it looks like you do have anxiety or it looks like you do have depression, they can talk to you and collaborate on a number of treatment options.
There's not oftentimes a quick fix to a mental health or a substance use issue. It takes time, and there's ups and downs. 3 steps forward and 2 steps back has never applied more than it does to mental health treatment and substance use treatment.
In general, a good way to begin for someone in school or in college is really to begin with what we call psychotherapy or talk therapy.
Starting with talk therapy, I think that's what most people think of when they feel like, okay, I've been depressed or anxious, I'm going to go talk with somebody. And what's important to know is that counselors and therapists, they're really good listeners, but they're highly trained at understanding what it can take to help people move through different issues that might come up.
And talk therapy actually has neurochemical benefits. So, the mild to moderate episodes of depression generally will respond to psychotherapy. So having good psychotherapy as a first step, I would say, would be the way to go.
There are a variety of talk therapies available, each with its own focus.
The problem-focused cognitive behavior therapy can be very effective. So, this is not therapy where, you're talking about growing up or anything. It's very problem-focused. You understand the triggers, you understand your thinking and your reaction around the triggers, you understand and you develop strategies to manage those.
Psychodynamic theory is going back to how you were raised and how your past affects your present. I use something called memory reconsolidation therapy to work with trauma. So it's more than talk therapy. It's a lot of visualization and relaxation to help you process painful past learning.
The psychotherapy in anxiety disorders can help you gain control of the anxiety through behavioral techniques. It's very effective and really needs to be the first step in most cases.
Often, doctors will add proven medications to help patients.
We have our talk therapy, and that's really helpful for a lot of different types of diagnoses. Medications can also be very helpful, but a lot of it depends on what the diagnosis is. There's where a lot of these types of things come into play to try to rebalance, if you will, the ratio of some of these chemicals in the brain, so that then we don't maybe feel depressed or don't feel too anxious when things happen. And that's what medications oftentimes will kind of work on, those types of factors.
The therapist will do an assessment and evaluate the severity, and typically they would do focus sessions, whether, typically it's 12 to 16 sessions to see how things go. And if the response rate is not there, if the individual feels that their goals have not been met, then at that point, they can start to look at a medication intervention.
There are medications out there that are very effective, and we know that. And I'm talking as a non-physician, so I'm not a physician. But when we look at the research, we know that medications are effective. Medications for anxiety are effective.
Maybe somebody can't get out of bed. They are very depressed. They're not taking care of themselves. They're not motivated, and it's impacted. They're not making it to work. It's not that talk therapy won't be helpful, but it's almost like we have to first get them up to a level where talk therapy can kind of take hold.
Beyond talk therapy and medications, there are other ways for patients to treat mental illness.
Things like meditation or mindfulness or yoga.
It might include support groups. It might include different things you can do for yourself in terms of physical exercise, changing your diet, some simple things that may benefit you, and in conjunction, there may be a menu of 2 or 3 different things that works best for that person.
Oftentimes, there's a combination of these treatments that people sort of engage in. Oftentimes, that's a better approach than just 1 or 2.
It is not uncommon for patients to have difficulties with treatments due to the stigma associated with mental illness.
Stigma has always been a challenge in the mental health field, but I will say, even in the time I've been in the field, I think we made tremendous strides toward normalizing the fact that a lot of us do need more support and do need help.
I think that we're good about talking about mental health. Now, crossing the bridge into treatment is still where there's a little bit more of a gap, and we have work to do on that.
Stigma does still exist. Some people are very hesitant to acknowledge that or to get help. And so it's just about letting them know that it doesn't make you a bad person. In fact, in many ways, it makes you a stronger person to be able to speak up, to say, yes, something is going on that's not right. I do need to see a therapist, or I do need to talk to somebody to see what I can do to improve this.
College of DuPage offers free counseling, available through counseling, advising, and transfer services, located in the Student Services Center, SSC 3200, or by calling 630-942-2259.
COD offers personal counseling services to students free of charge. Just by being a student here, students have this resource available to them.
Give us a call, let us know what's going on and what you need, and then we'll help you out.
The service we offer to students is personal counseling, and so we differentiate that from therapy in that we do not diagnose and that we're not a clinical setting.
The college, focuses on more short-term counseling, and so we're really looking at helping students through life transition issues, things that are really getting in the way of students being able to be successful academically. And so usually we will see students where it's a short-term issue, something that can be resolved in 3 to 4 sessions, and then the student is able to proceed and be successful in college.
We'll figure out what you need to do. We'll connect you with a counselor who will have a conversation with you about what's going on with you, and from there, we're going to figure out how to best help you.
If you're having problems, remember, help is available, and most often, making that first call is the hardest thing to do.
It's okay to not be okay. In fact, it's very strong of you to ask for help.
So many people are going through the same thing, and I think it's so much more important to be able to talk about how you're feeling, talk about how you're not feeling okay, because that's the first step to getting better.
Meet Amy and Carly. Amy is a College of DuPage graduate, now attending Johns Hopkins University. Carly is a College of DuPage freshman. Both have lived with mental illness, but have very different stories. While different from one another, their stories are the same as many of their peers.
I realized something was different because I was just sad all the time. I was basically like what you imagine depression would be. I was moping around school. I didn't talk. I just didn't enjoy anything. I didn't want to do anything anymore. I wasn't interested in school. And I was diagnosed with major depression and social anxiety.
Before COVID hit, I was in high school, I would say sophomore year. I was so happy. I had a really solid group of friends. My grades were phenomenal, all A's and B's. I really enjoyed going to school. especially connecting with my teachers. That's always been something that's really important to me in high school, is just building those good relationships, because those are the people you learn from. And then COVID hit, and they were like, yeah, well, you'll be back after spring break, but it never ended up happening. And then they switched to school being online. So So there I am, just lonely, confused, just not in a good state at all, feeling horrible about myself, just very insecure.
I tried to hide it as best as I could, but at the same time I was hoping like someone in my family would notice. And my mom, she sort of did. She asked me a few times if I was okay, if I was depressed, but I just told her I was okay. I'm not exactly sure why. I didn't want to worry her, I guess. But I did have a lot of visits to the doctor because of physical pain, which is one of the symptoms of depression. And the doctor was the one to figure it out. Like after the 4th visit in that year, he was just like, okay, I'm gonna have you fill out this questionnaire. And I did, and then he said, yep, it's depression. Exactly like that.
I had no motivation to do anything. I was actually diagnosed with anxiety. They put me on some anxiety medication. I got diagnosed with an eating disorder too, so it was just a lot going on in that time for me. It was a lot mental health-wise, just mentally. I just wasn't completely there. I was going through a lot of difficult times with my family, with my relationship, with everything. I was just so down on myself. I just didn't feel good. I wasn't happy at all. And my eating disorder really started to catch up to me when I was at work, because I just wouldn't eat anything all day, and then I would go to work, and then one day at work I fainted. So my manager was like, okay, like I want you to go to the doctor and get this checked out. So she honestly pushed me a lot too. I wouldn't just say it's all me, but I did know that it was the right thing to do.
In the beginning, my treatment was quite simple. It was just, okay, we're gonna try therapy, talk for an hour, and let's see how that helps. And then after that, they decided that it'd be best if I got a psychiatrist to start me on some medication, and my mom and I agreed, so we started with that course of treatment.
It was hard to say that I think I need help, for sure. I was just feeling very down about myself. I didn't want to go outside. I didn't want to do anything really, so I was talking to my mom about it, and I was like, Mom, like I think I need to go get this checked out. I need to go do something about this.
I think it's okay not to be okay, because no one is ever okay. We're all dealing with things. It's just that nobody knows about them. And yeah, some people are able to manage it, push through it, but it doesn't mean that they're stronger than those who can't.
These next 10 years of our lives are literally the most important next 10 years. Because this is when we choose what we want to do, and we chase our dreams, and we save up the money to move out, and we get married, and we have kids, and we start a family. It's just all in these next 10 years that there's just so much leaning on them, and it makes me nervous, it makes me anxious, but it also just makes me so excited, because I just want to get out there. I just want to live my dreams and live my life and do what I want to do, and I'm just very, very excited to really just start my life and make that step and just go for it.
As you can see, there is a lot of pressure on college students. For some, like Amy, it can become overwhelming.
I was hospitalized for suicidal ideation. So I guess from talking to my social worker at school, she would tell me like, oh, I think it's time for you to be hospitalized because the thoughts or the depression just got too bad.
Tragically, that was not Amy's only hospitalization.
My original intention was not to hurt myself or end my life. It was just to take some pills, my anxiety pills. I took like the rest of the bottle just because I wanted to feel relaxed, but that lowered my inhibitions. I guess the first thing that I wanted to do without thinking about anything else was just to go into the medicine cabinet and take all the pills that I could. So that's exactly what I did. I was drowsy and I wasn't thinking straight, and I called my brother. to tell him what I had done. And he called the ambulance for me. And then after they put me in the ambulance, I don't remember anything from that. I just remember waking up like 3 days later.
With treatment, both Carly and Amy are now doing well and moving forward. But getting started on the path to recovery was not easy.
I would say therapy over the past few years, 6 years, it has helped me become a better person. I'm able to cope better. I am more optimistic.
I can reach my goals. I can do live my dreams. I just have to get there, and I just have to make the first step. So I think the biggest thing would be just taking the first step.
When I started COD, it was after my most recent hospitalization. I don't know, I guess I found that joy in school again. And I don't know, I just all of a sudden I had goals again, had motivation. So I worked hard here.
Amy went on to graduate from College of DuPage and now attends the prestigious Johns Hopkins University in Baltimore. She is still being treated for depression and anxiety, but now has a new perspective.
Just because I require all this extra help and treatment doesn't make me weak. In fact, I think it makes me stronger. And I think a lot of kids need to hear that. There's nothing wrong with them. Their brain just needs a little bit of care and compassion.
So if you just make that first step, you just make it known, I promise you that there are people in your life, or you can find people in your life that will help you, that do love you, and they will get you through it. So all you have to do is just say something, do something. Make that first step, and everything else will fall into place, I promise.
If you are thinking of suicide or hurting yourself, dial 988 immediately. The Suicide and Crisis Helpline provides free, confidential support. Help is waiting 24 hours a day, every day.